The 10th Surgical Updates Conference, organized by the Oman Surgical Society, has concluded at the Oman Convention and Exhibition Center, with around 400 participants from the GCC countries, other Arab states, and the international medical community. The conference brought together surgeons and healthcare professionals to discuss advances in surgical practice, research collaboration, training, and the expanding role of digital transformation, artificial intelligence, and robotic surgery. In the keynote address, emphasis was placed on the life-saving role of surgeons worldwide, particularly in conflict-affected and fragile regions. A special focus was also given to the Sultanate of Oman's move toward centralizing healthcare services, expanding specialized surgical care across governorates to improve access, readiness, and long-term sustainability.
Very interesting conference. The focus was mostly about surgical innovation and technology. We actually saw the effects and the efforts of the surgeons being done all across the world, especially in areas that are conflict afflicted or fragile, have fragile systems, whether they are in Africa or in the Eastern Mediterranean region. Even though the region is classified as the most humanitarian afflicted area, crisis area, there's a lot of efforts that are being done on individual level, on organizational level, on regional level, and on national levels. All of these things, all of these actions, they build up to hopefully a positive, better future.
The event highlighted strong academic engagement with active participation from medical students and young researchers. Medical students received the Best Abstract Award in recognition of outstanding scientific research.
A senior medical student from King Faisal University in Saudi Arabia. I am very glad for this conference. It helps me a lot, especially in the robotic surgery, and I collaborate with many people to do research in the future. I hope this conference will happen in the future years, and I will be the first one to come and attend.
On the final day, a competitive surgical quiz was held for the residents from the Sultanate of Oman, the State of Kuwait, the Kingdom of Saudi Arabia, and the United Arab Emirates, adding an interactive dimension to the scientific program.
A gathering of all the surgeons from Oman and from the area. Most concluding remark is having a consensus on some management of some conditions, which is very good to have a consensus, because we are one group. We need to have a consensus, like we have a consensus on management of the gallbladder polyps and a consensus of management of few other diseases. And this will unify the treatment of all Omanis in all over the hospitals. And it's a good thing to happen, and we are looking forward having the same thing in many other conditions.
The conference concluded by emphasizing innovation, education, and regional cooperation, reinforcing Oman's growing role in medical education and surgical development. A dynamic gathering that creates a powerful platform where the global expertise meets Oman's drive for advanced health care. From Oman Convention and Exhibition Center, Madinat al-Irfan, Muscat, I'm Abdullah bin Ahmed al-Rubi'i, Sultanate of Oman Television.